Well, first of all, I want to thank you for spending some time. This is an important time for us to hear from all of you about your experience. And as I said, you just did the deep dive into the fellows. And it was in November that this started. So thinking back to November, thinking about this session today, what's really changed for you in that period of time?
I think, for me, it's really been probably better defining what advocacy can be in my particular world, in the realm that I work in now. I've also worked in a more statewide way before and done what I would consider maybe more traditional advocacy. And now what I'm working on is advocacy with direct service providers and patients and that sort of thing, and they don't view themselves as advocates. So this has kind of helped me narrow, I think, ways that I could help them think of themselves as advocates and as people who do have a voice that needs to be heard.
Well, and I think that's something you and I talked about the clientele. You don't think about taking an advocacy structure back into the organization, but you were talking about, you just said, really trying to facilitate good advocacy work with other community partners. Can you talk about that a little bit?
Absolutely. So a couple of the things we've been working on as a direct result of the fellowship is we formed a thing called Community Health Champions. And we got some funding through the Kansas Health Foundation and through KMU to form a community advocacy team. So it's comprised of university, the hospital, the faith community, patients, board members, staff members. And this is all very new to all of them, but the charge really initially is going to be focused on CanCare expansion. Beyond that, we want an ongoing vehicle to help advocate for improved health outcomes in what is a very, very poor and very underserved part of the state.
So has the experience with the foundation anything that stands out that has helped to drive that coming together?
Well, I think having a diverse group of people in the fellowship really helped me understand, because we immediately thought about Blake Benson at the Chamber, who's a great partner, but we wanted to get him involved, immediately wanted to do it. So it's not the health department and the mental health center. We were very intentional about bringing people who share our goals, but what we had to do is better articulate our goals to them to get them on board a little bit more. So it really changed the way we thought about who is our target to be a part of this group.
Okay, that's good. And one of the things that is a dimension of that work really goes back to the theme that we really tried to incorporate throughout the Sunflower Fellow session, and that's one of civil discourse. And civil discourse means many things to different people. Sure. And one of the things I observed about you, Jason, and knowing you a little bit, is that you're quite a pensive person. You're very thoughtful. You sit back when you have the opportunity to be quiet and think about things. So what are your thoughts about the whole issue of civil discourse?
Well, I think in our community, we work in very small towns in a very poor part of the state, and there is no avoiding the people that you don't agree with, and so we also tried to include some people in that team who we may not agree with on every issue. Because we have become a very large organization and we all kind of think similarly. We believe in access to health care. Well, not everybody does. And so I think thinking through not carving people out, but carving people in about the way you communicate has been important. And we even have staff members who may or may not think the Affordable Care Act is a great idea, right? So you have to have that conversation as well.
That's great.
Yeah, absolutely.
Okay. Well, just to kind of wrap things up a bit, what would you give us as feedback or insight about the opportunity you have, and kind of mix that with a message you would give people coming into the fellowship?
Well, I think for me, it's, as I shared with Melissa earlier, it's kind of like I do math and I'm sitting in a physics class, right? I feel like a lot of people in the group know a lot about this that I don't know, because I go back and I've got two nurses fighting with each other and break it up, So my world is a very immediate, on the ground, do this work right now, and it's incumbent upon me to step, maybe not up, but back, and continually reframe the message and focus my staff about we're not just here to provide care to people, we're here to be a voice and help them have one too. And that is hard, but that doesn't mean it's not my responsibility to do it. And I do think that I would really encourage continuing bringing a diverse group of people into the group. I've even thought more about who did we not invite that maybe we should, maybe doesn't agree with us on stuff. Be an interesting.
And we'd be interested to hear from you on that.
Yeah, I think that would be good. And I also, I guess the one piece of advice that I would give to anybody in any situation is when you come into a situation, just listen and be blank. Don't bring a bunch of biases to it, because I think I've learned a great deal. And I've also learned that there are many opportunities out there, and I have to stay open to those and not get so focused on, email.
There you
that
go.
sort of thing, right? Because it's easy.
There you go. Well, on behalf of the Sunflower Foundation, I really want to thank you for your commitment and your contribution, and we look forward to having you a part of that larger fellow network.
Sure.
So thank you very much.
Thank you, and thanks for inviting me.